This one has positive arrow and arrowhead signs. We love it when the radiologists are nice to us. First, you need to know what we're dealing with. This is probably the pulmonary trunk leading into the left and right pulmonary arteries. So this is coming off of the right ventricle, going to the lungs. This big red arrow is pointing to this bizarre structure here. That dark line is a pulmonary embolism kind of sitting in the wedge between the left and right pulmonary arteries. This is what's classically known as a saddle embolus. These arrowheads are pointing to these lucencies here. These are also just filling defects. The bright white represents your blood with contrast, and the darker spots means there is no blood. Sometimes it's not this obvious. They don't give you this nice, clear line. If they do, obvious pulmonary embolism, but just look for this kind of T shape telling you we're looking at the pulmonary trunk and pulmonary arteries, and then look for some dark spots. If you see those, you're probably looking at a pulmonary embolus. So treatment for these depends on largely two things. If there's bleeding risk and if the patient is hemodynamically stable. If the patient is low risk, meaning there's no bleeding risk and they're hemodynamically stable, you're just going to treat it with low molecular weight heparin for the most part. If they're intermediate or high risk, or in other words, they're hemodynamically unstable and there has to be no bleeding risk, then you bring out the big guns. That's your TPA or alteplase. If the patient has bleeding risk, then you might want to consider mechanical thrombectomy, especially if they're hemodynamically unstable. You want to avoid hemorrhagic strokes in people with bleeding risks. For example, if they're already on something like warfarin and anticoagulant, you don't want to give them more in most cases. You can also consider an IVC filter to prevent recurrence, but that won't help with the current case. That's an inferior vena cava filter.